Okay, today I am at my MLD appointment at Peaceful Walk Therapy, which is in Plano, Texas, but she also has a location in Dallas. And so I just wanted to introduce you to my physical therapist.
Wow.
This is Sarmita Misra, and she's amazing. I found her through Linda Ann Kahn, because I will tell you that finding a good MLD therapist is not easy, because you're not the first one that I tried, and it just I wasn't getting the benefit that I knew I was needing. So it's kind of hard to find one. So thank you, Linda Ann, for recommending.
Yes.
And so I just wanted you to maybe tell everyone kind of what our treatment plan, like going forward, looks like.
Great. Well, welcome. I just want to first of all say thank you to Linda Ann Kahn and to my mentor, who is Linda Ann's mentor as well, Catherine Thrift. And so these are the individuals who have been teaching us for a long time how to do manual lymphatic drainage therapy. And for Sean's particular case, being that she has lipedema and she's had surgery, her liposuction surgery to manage her lipedema, the reason that we want to effectively provide manual lymphatic drainage therapy is for two reasons, especially in her case. First, she has a lipedema. With lipedema, it's a connective tissue condition. The connective tissue is doing changes within the body, which is impacting the way the lymph system is getting compressed upon when the tissue expands. So that expanded tissue, some of the nodules, some of the expansion that you see, not just at the macroscopic level, but at the microscopic level, is pressing down on those small lymphatic vessels and definitely on the microvasculature, like your arteries and your veins. What does that do? It slows down your lymphatic flow, but also irritates the area enough with a microinflammation where you actually, what we call, filtrate out the fluids more into the tissue. It's a response. And so there's more edema, more fluid on board. The manual lymphatic drainage therapy, when done properly, and I've been trained through the Dr. Votter School of Manual Lymphatic Drainage Therapy, the original training, very light touch technique. It is to mobilize that fluid and help it be transported through the lymphatic vessel system. And it's a directional flow, and it's a very precise type of therapy that we do with our hands, light touch on the skin, not a heavy touch. Very different from massage. You will never hear me use the word massage when it comes to lymphatic therapy. Secondly, for Sean, because she's had surgery that you've been following and an upcoming surgery, when anyone has surgery, what happens? The issue is that your healing protocol and the healing aspects that happen post-surgically, there's inflammation that happens. Normally, natural, supposed to happen. However, there's more edema that can be perfusing through the tissue, right? Because of that healing component post-surgically. So what are a couple of things that we can do to alleviate some of that extra edema to enhance the healing and reduce its time for the actual bringing back the tissues together for that really optimal healing, is to mobilize the edema out of the tissue. Doing what? Doing manual lymphatic drainage therapy. So we often advise our patients, if they are aware of it, that come in for therapy prior to your surgeries, any surgeries. But in this case, even more importantly, because of the condition of lipedema that's on board, most definitely post-operatively or post-surgically. And there's a routine, and your physicians who are your surgeons may adopt this kind of a protocol. Otherwise, you as a consumer of your own health know that manual lymphatic therapy, manual lymphatic drainage therapy, is very important post-operatively, preoperatively. It gets the flow going prior to your surgery, so things are already mobilizing and flowing along. We've had multiple reports from most of our patients that say, you know what, because I did the therapies prior to surgery, I had a really very good, excellent recovery, and my surgeon was very pleased and really saw the difference because of that compared to maybe someone who did not have those therapies. So I want to wish you all the best of luck. You will do great. And she's so diligent. She's an awesome, awesome person, an awesome patient. But the key is knowing that this manual lymphatic drainage therapy has multiple uses. it also detoxifies the tissue. So Sean has been really good about her protocol, and she's helping her own body by doing this because it's also known to detoxify the tissue. The third thing, which luckily for Sean's case, when there's pain involved with lipedema, where there may be because of the nodules and the compression that's happening because of the edema and the soft tissue changes, manual lymphatic drainage therapy is known to help with pain management. Why? It's because manual lymphatic drainage therapy, when done properly with the light touch technique, allows the pain response to be reduced. So it reduces the sympathetic nervous system response. Okay, so your fight and flight response is reduced, deep relaxation, deep reduction of stress, and it actually goes ahead and enhances the parasympathetic nervous system response, which is your rest and digest system. So it brings that about. And thus, pain is also very, very effectively managed, also with the light touch. The brain is receiving this soft, gentle signal as opposed to receiving the pain signal. So it helps with that as well.
Yes, I've noticed like so much improvement, and she's so knowledgeable. Like when I'm here, I should probably be relaxing and like sleeping, but we end up talking usually every single time because she's just a wealth of knowledge, and I'm like, tell me this, tell me this. So I really appreciate it. But if you guys are in the Dallas area and you're looking for, and I love that you said you don't say manual lymphatic drainage massage, it's manual lymphatic drainage therapy.
Correct.
And that's a great point because it is very different. And so if you're having it but it feels like a massage, that's not how it should feel. So if you're looking for someone in the Dallas area, check her out. I'm going to tag her page. Thank you so much.
Thank you. Thanks, Sean.